I received an email this week from a student of the online Wilderness First Aid course asking for clarification on when we should use the recovery roll and place the patient in the recovery position. I replied to the student and I thought that my explanation will make a great addition to the online course. So for all the graduates of the course and anyone else, here's my answer for when to place a patient into the recovery position. If the patient has a potential positive mechanism of injury, we need to keep the patient in a supine position on their back with reminders on their head to keep their head still while we perform the primary and the secondary assessment. However, there are times when we may need to roll the patient into the recovery position due to an airway obstruction or breathing difficulty, and we need to roll the patient in a way that protects the patient's spine. So, let's discuss the 4 situations where we will roll the patient into the recovery position. Number 1, we find that there's liquid in the patient's airway. Number 2, the patient is nauseous and there is a potential the patient may vomit. 3, the patient is having breathing difficulty and the recovery position may be a potential position of comfort and ease the patient's breathing. And number 4, the patient is unresponsive and we have completed the primary and the secondary assessment. So let's start off with number 1. We find liquid in the patient's airway. So let's say that you have an unresponsive patient laying on their back and you open the patient's mouth and you look inside and you find the mouth is full of liquid blocking the patient's airway. We do not want the patient to aspirate, inhale this liquid. That includes food, drink, vomit, or saliva into their lungs. Inhaling substances other than air will cause aspiration pneumonia. It's a life-threatening bacterial infection that can cause severe complications, especially if a person waits too long to go to the doctor. The infection may progress quickly and spread to other areas of the body. It may also spread to the bloodstream, which is especially dangerous. So use the recovery roll to place the patient in the recovery position and allow the liquid to drain out of the patient's mouth and open up the airway. Number 2, the patient is nauseous and there is a potential the patient may vomit. The responsive patient may tell you they feel nauseous and may vomit. Proactively roll the patient into the recovery position so if they do vomit, they will not aspirate the vomit into their lungs. Number 3, the patient is having breathing difficulty and the recovery position may be a potential position of comfort and ease the patient's breathing. Now, we can't set a patient up with a potential positive MOI until we clear the spine. And so a patient having breathing difficulties lying on their back may find comfort and easier breathing in the recovery position. Roll the patient into the recovery position and see if that makes the patient's breathing more comfortable. And finally, number 4, the patient is unresponsive and we've completed the primary and secondary assessment. An unresponsive patient lying on their back may spontaneously vomit or may begin to experience breathing difficulty. And the best way to manage the airway is to place the unresponsive patient in the recovery position. So that's the 4 reasons why we will use the recovery roll and place the patient in the recovery position. I'm going to be adding this presentation to the School of First Aid's online Wilderness First Aid course. And for those of you looking for an online Wilderness First Aid course, either for a certificate or for a certification with a proctored skills assessment, I encourage you to check out the course in the links in the video description below.